Yeah. Okay. Good morning, everyone. Welcome to this meeting of the Social Affairs Policy Review Committee. I'm Anne Call at MHK, and with me are Mr. Tim Glover, MHK, and Mrs. Dawn Kinnish, MLC. Today we're meeting with representatives from the Safeguarding Board. Welcome to this oral evidence session. For the benefit of Hansard and those listening, could you please introduce yourselves, including your title and how long you've been in post?
So I'm Christine Impey. I'm the Director of Multi-Agency Safeguarding, and I've been in post now for 3 years.
Thank you.
Hello, and I'm Leslie Walker, the Independent Chair of the Safeguarding Board, and I've been in post now for 4 years.
Thank you. I'll hand over to Mr. Glover.
And start with. Could I ask to just read a pre-prepared
of course you can.
introduction?
Sorry. Yes.
Just I thought it would be just helpful.
Absolutely.
Set the scene.
Thank you.
Just this statement's really just to assist the committee and any others listening in understanding the roles, key roles and functions of the Safeguarding Board and my role as the Independent Chair. So as the committee is already aware, the Safeguarding Board is a partnership of the key agencies responsible for the provision of safeguarding services, and the regular board meeting is chaired by myself and involves the chief executives of the relevant departments, DHA, DESC, DHSC, Manx Care and the Chief Constable, as well as the 3 independent members that are laid out in the legislation. And the board's statutory objectives, as laid out in the Safeguarding Act, are to coordinate the work done by the relevant safeguarding bodies or agencies for the purposes of safeguarding and promoting the welfare of children and safeguarding and protecting vulnerable adults, and most importantly to ensure the effectiveness of the work done by each of those bodies. So of course this involves driving and coordinating multi-agency work linked to the board's key priorities in the business plan and is led by the board subgroups. There's robust quality assurance and scrutiny to measure effectiveness and impact of both single agency and multi-agency work. And a key role is obviously undertaking the serious case management reviews where the criteria are met to determine any necessary improvements and hold agencies to account in delivering change. And then reporting this work through the board's annual report, which I know the committee have had a copy of. So just to be clear, as the Safeguarding Board is a partnership of key agencies responsible for the delivery of safeguarding services locally, we rely on the information and data provided by those agencies. And the responsibility for safeguarding does sit with those individual agencies, and therefore I can't respond on behalf of those agencies with detail in terms of their data or information. But of course, if the committee need to request any further information or clarification, then we're obviously we'll take that back to the relevant agencies. And likewise, we cannot, as we have said previously, respond in relation to specific policy developments or work of any other boards or strategic bodies. But again, we would try to direct the committee to where the information may be available. And we will, however, endeavour to provide our independent professional opinion and any information appropriate to assist the committee. And just finally, we hope to be able to outline through our evidence today the improvements the Safeguarding Board are driving forward to protect citizens from abuse and harm. And in particular, we're keen to highlight the changes we hope to make to the Safeguarding Act through the Amendment Bill to strengthen the duty to share information for safeguarding and promoting the welfare of children, young people and vulnerable adults.
Thank you. Okay.
Start with work in the area of child exploitation. And as you know, criminal exploitation of young people is a matter we've been considering. You provided us with a helpful summary update in August, it was dated August 2024, of the work you were leading and otherwise aware of in relation to child exploitation. Can I ask what progress has been made with the next steps and work with the exploitation subgroup since August 2024?
Yes, Christine, because you're leading that work.
So we have established membership of an all-age exploitation subgroup. Our priorities initially have been to work on the areas within the sphere of child exploitation, both criminal and sexual. And I think the last time we were here, we touched on that we were going to have a reset workshop following the findings from Leslie's scrutiny report into child exploitation. Following that, we have commissioned a project lead to drive the process and practice arm of that. And we have completed that first tranche in terms of the multi-agency partners and the steering group have now completed their co-production of a new set of working protocols, tools and pathways. So that is in its draft form at the moment, and that is going to go through our governance process to being signed off in order then we can implement new ways of working from a multi-agency perspective, coming at it from a contextual safeguarding approach.
The Vulnerable Adolescent Strategy was originally to run from 22 to 24, and given that the 2024 summary suggests that there is more work to do, has this been extended?
Well, what we would plan to do, or what I would plan to do as the independent chair, is to, when the work that Christine's outlined comes to the board for consideration and amendment, we will then need to amend that strategy anyway, because some of the protocols and ways of working will change, and I would be very keen that, of course, we then at that point extend the strategy into and look at the opportunity to link that into the all age area that we've already highlighted and talked about. So that would be the plan through the board once that work is complete. But we would need that work to be complete, which is why we haven't revised or updated the strategy at this point until it's done.
And how long has the new exploitation support worker been in place? And can you maybe just talk us through their role?
I think, as Leslie's highlighted at the beginning, that's more of an operational point practice issue, which doesn't formulate part of our work. It is something that sits within children and families. So I wouldn't be able to help you in terms of the specifics in terms of that role. My understanding is that I think there are 2 exploitation workers now within children and families, and they offer one-to-one support for those young people that are at risk of or are indeed being exploited.
Are you interested in the project support work or the workers on the ground, just to be clear?
Just to see how their role is going and what
You mean the project officer that we have in? It's more about the project officer.
Sorry. So the commissioned person, who is a safeguarding expert, she has worked with a number of partners in a number of settings, gathering their views, looking at what has been working, what's working well, what needs further improvement. She has led on a co-production of all of the products, and I think she has a good sense of how things are working at the moment, and also what she's seeing in practice terms where the gaps are.
Thank you.
And when did she start in her role?
And she started on Ireland, her work, in October last year.
Chair.
Thank you. Could I just clarify then, we were talking about the Vulnerable Adolescent Strategy. So are you now producing a new strategy, an all-age strategy? Is that the intention here?
Well, that will be once we get the the work that Hannah's been undertaking as that project lead, and through all of her observations and the proposals of what changes need to be made to strengthen the work, that's the point at which we'll stop and review and look at the implications for the strategy and the best way forward at that point. But our priority is really to ensure that, as my report outlines, that the day-to-day practice is appropriately assessing risk, supporting families, reducing risk across all of the agencies. So our priority is really to strengthen the practice rather than necessarily immediately do the work on the strategy. It will fall out of the improvement work that we're trying to do on the ground, which is what my report really highlighted was the pressing area for. But we do need to then update the strategy and put all the proper links to the new working protocols so that all staff across the island are very clear about the processes, the ways that they can report, recognise, and that what action will be taken as a result, what meetings they'll be called to, what expectation will be on them, and how they will contribute to those meetings. So there's a lot of the work is all around that detailed frontline practice in terms of exploitation locally.
Okay,
that helps.
Yeah, the point I was trying to get at there is rather than just have a vulnerable adolescent strategy,
yes,
that you've got a vulnerable everybody strategy.
Yes, and the working group, as Christine mentioned, the terms of reference of our working group is an all-age exploitation working group, and the action plan, which I've had have oversight, and it has come to the board as well for scrutiny in terms of bringing in the aspects of an all-age approach, because that is absolutely what we need to do.
Thank you. Mr. Glover.
The report does mention the reinstatement of the exploitation tracking mechanism. Is this now in place, back in place?
Well, the tracker that we are alluding to will come via the exploitation subgroup. So the exploitation subgroup is in its early stages. So we haven't got a tracker across that whole piece yet because we're not clear about what that pathway is going to be looking like until we've seen the draft and it's been through the governance processes, because the tracker will need to align to the new ways of working.
But the tracking and data in respect of children, young people, which my report highlighted as an issue, is happening because we now get regular data sets in terms of numbers. So there is improved tracking, and it was an immediate action was taken following the scrutiny report to ensure that area was strengthened, and we have had assurance back that has happened. So we get regular data on numbers on a quarterly basis. There's tracking of those young people, and many of some of the key aspects that were for improvement that were identified. We have had some assurance that those are that those have occurred. But of course, this review of what is the best way to achieve that, the necessary changes that were identified are coming through this piece of work that's just been drafted and due to come to board.
You've mentioned improved flows of data, which of course is critical relevance and has been cited as a weakness in a number of government areas in the past. So how many people are being affected in the ways you've described in your report? What sort of figures are we talking about?
The latest figures in terms of there were at the end of the last year, there were 11 children that were at risk of exploitation, but 85 children in all who were discussed at the daily exploitation meetings through that period.
And just to expand that further, how that breaks down for the year is in terms of those children that are at risk of criminal exploitation, that was 59. and those children at risk of sexual exploitation was 16. Now those are entries into the system.
Yeah. Thank you. And just to finish this section, how successful do you feel Fearless, the joint initiative with education partners, is being?
Sorry, just repeat the question. I didn't hear.
How successful is Fearless, the joint initiative with education partners? How do you see that as a success or still a work in progress?
I mean, there was obviously a lot of promotion of that during Safeguarding Week, but I'm not sure whether through the children's group, Christine.
I think it would be difficult to be able to say and measure that, because of course the fearless.org is an anonymous mechanism for young people. So unless children are sharing with their trusted adult within school that they are or planning to or have made a contact to fearless.org, we wouldn't know about that.
What we are seeing in terms of this, that some of the data is that previously and historically, that many of the issues around, particularly around exploitation, there were concerns about children who were looked after or cared for. But we've seen a switch in terms of now a real increase in children who have been identified who are living in the community, living in their own, living with their home or with their carers. So that does suggest to me that the recognition, the reporting, children coming forward and being identified certainly has significantly improved, because we're now identifying actually what's going on within communities rather than just the children who would be clearly very visible, who would be in the looked after system, in the care system effectively.
So the numbers you've mentioned, is it difficult then to compare to previous years to see if this is a larger number, a smaller number, because you're now able to identify people from a wider sphere of,
yes,
of areas of concern?
But we definitely, because we're seeing that increase, and if we look at other jurisdictions who have followed a similar pattern, the issue was that there was concern that children and young people within the community were not being well identified, whilst there was good recognition with young people perhaps who were in care, because, as I said, they're more visible, they have staff groups wrapped around them, the indicators are more easy to pick up. The fact that we're seeing that increase in some sense is as a positive, that recognition at a local level with all the campaigns that we've done, and what the scrutiny found is that there was good recognition of the identification of some of the risk factors. Very good evidence, for example, in schools, that they knew what the signs were they were looking for. In my as part of my scrutiny and talking to education representatives, I was able to see that really good recognition. They were able to outline cases that they're concerned about, young people are concerned about. So that does suggest that certainly the campaigns, not just the Fearless campaign, but other campaigns are working in terms of identification and recognition. Now the focus obviously really needs to be disrupting, reducing, wrapping around young people to reduce that risk and harm. But it is a complex area, and other jurisdictions continue in most safeguarding partnerships. Elsewhere, this continues to be one of their key priorities, because it is very, very difficult. And of course, the criminal exploiters become more and more sophisticated in their techniques around trying to avoid detection and to link in with vulnerable young people in particular, for the purpose to exploit them for their own purposes. So it is a complex and difficult area.
Thank you. Mrs. Kinnish.
Thank you. I just want now to look towards Safeguarding Week that you had last November. So that was the second Safeguarding Week. The theme, as we've mentioned earlier, was about age exploitation, all age exploitation. We've had a look at the programme, but I wonder if you could just tell us a bit more about the events that were offered.
So, do you want to start off with this one, Leslie?
Yeah, I can. Yeah, so you'd be aware that there were a number of media interviews that week, including with myself, but more very much focused on practitioners speaking to the media about their roles, helping the local communities to try to understand the roles and functions of those individuals. So very much it was trying to help facilitate an understanding around that all age exploitation. So there was, as you could see, there was a huge programme that was on that week, trying to really bring that down into the community. So particular focus with those wellbeing partnerships as well, drop in, particularly focusing that on the older age exploitation. Then things that were more focused probably at professionals, which were around exploitation workshops, and specific training sessions that were put on during that week, and then obviously the promotion through the Isle of Man Constabulary. We wanted to bring as well the focus into community and voluntary sector, which was really important, and so we'd got particular sessions with charities and volunteers that were held during that week, again trying to reach further into all of those who may be in contact and being confident that they're able to recognise the signs, the symptoms, and to know what to do, and how to refer and how to deal with with those issues. So a really pretty full programme. Obviously DESC, as you've talked about, the Fearless campaign, Children's Health put on 2 training sessions, and as I said, wellbeing partnerships put on all around the island in terms of focusing more on that older age exploitation, as well as some of the specific more professionally based sessions.
Thank you. Would you consider that the uptake was quite good on those events that you put on?
That was very good. I think you've had some figures, don't you?
Yeah, I would say so. I think that the variety of activity that went on was targeting different cohorts of people. I think the community-based ones were more of they were there and people dropped in to those various locations across Ireland. And I think that there probably was quite a uptake in the professional world in terms of the number of sort of seminars and workshops that were put on throughout that week. So I would say yes. I think that the target audience was quite diverse, and the feedback that we had was positive and encouraging to hear. It was our second year of doing it, so each year comes with its own set of challenges, and attracting different sectors and agencies as we widen that reach of Safeguarding Board promotion.
It really showed for me the strength of the partners in coming together and and putting on so many events as part of the week. So we had a very generalised safeguarding week. The first year we decided to have this particular focus on the key business partner. We're always looking to develop this, and so again as local representatives, if there are any ideas or thoughts about what might best help us get some of those safeguarding messages into communities, we would really welcome those.
Thank you. Just to follow up on that, is this intended to be an annual programme, is it?
That's my aim.
Thank you.
Of course, I can't do it without the goodwill of our partner agencies, because again, this is another ask on top of our multiple asks that are on top of their day jobs. So it is about really capitalising on goodwill of partners.
Thank you.
Just to follow on with that, could you sort of tell us how that the awareness and the messaging that goes on during Safeguarding Week is sustained throughout the year? Do you have other things to, rather than just a kind of a week blitz and then nothing till next year?
Yes, we post regularly on our social platforms and through our Facebook page as well. And there are various things that we do throughout the year just to keep people's awareness around particular topics front and centre, really. I'm just looking through to see a number. If you've got them to hand, that's helpful.
So we had a whole list of particular things around such a range of subjects. The World Suicide Prevention Day. We were doing articles on the narrative of suicide as examples. We've had particular things around promoting, as we talked to the committee about last time, the managing allegations about people in a position of trust, again trying to embed the knowledge and awareness of that through the National Icon Week, which is around trying to promote safety in crying in small babies, because we know that with babies are particularly vulnerable in terms of the impact of abuse and harm and the stress that can put on parents. And so we had posted resources, and we've agreed to, we're doing some work around that particular topic led by health colleagues, and we'll be doing further campaign around that. And then we'd things linked into modern slavery, stuff around a digital toolkit in terms of internet matters, with some victim support collaboration pieces that we put out. We've put out stuff on the dangers of social media. We obviously have our newsletters that go out to professionals, but this is much wider. Carers Week, World Elder Abuse Day, Learning Disability Week. So we have a whole range of things that we're constantly filtering, particularly where they match with particular days that are, exploitation, National Exploitation Day. We'll have particular campaigns that try to link with that, because there'll be messages in international media even about those around the world. So we try to link in with those. So I think there's a whole list of others, and we have some of the data around the response to that, then, in terms of how many people have seen it, how many people have shared it, so we're looking really to further develop that. But we've been doing quite a lot, and a lot around campaigns across through some of the other areas that have been a key area of focus for this year, not last year's in the annual report, particularly around the self-neglect piece. Huge promotion, and I hope you've seen some of the posters around the Island GP surgeries, a whole series of local poster campaigns around, again, recognition, response, and we can see that those have had an impact, because we can see that when we have either carried out a campaign, or we've had the review, the thematic review of neglect, and then a whole promotion around that, we can see that actually the referrals track some of those campaigns, which does demonstrate that some of the messages are absolutely getting out there, because people are then responding by making referrals about families, colleagues, friends, whoever. So.
Okay.
Thank you. Could I just follow up a little bit on that, and just trying to understand when thinking about self-neglect, when you've got social workers working on the front line, and they will obviously see particular challenges day to day, how does that information from those frontline workers feed back into a more strategic level? Are the voices being heard of the people on the front line?
Good question, and they certainly are, because I've just a few months ago finished off the scrutiny piece on self-neglect. So obviously we had the serious case management review about the sad deaths of 7 individuals where there was concerns about self-neglect, and as a result then we developed again strategy, new working protocols, tools, training, but what is critical in terms of the Safeguarding Board's role is it then evaluates, well, we did all that work, so what was the impact? And one of the key pieces on that were to speak to groups of practitioners about what does it really feel like, again in quite a complex and emotive area. So I led sessions with practitioners where they were very, very open, reflective, and gave me a lot of information, and part of that then was triangulated with audits, and I spoke to 5 individuals who had a significant history of self-neglect to talk about the impact then that the new ways of working were having on them. So it was, and we'll be reporting a lot about that in the next annual report. But suffice to say, for this committee's information, that there was a very, very positive outcome to that scrutiny. So the stories, I have to say, from the individuals and the impact on their lives was really quite remarkable. That was also evidenced by the audits, the data. So we could see that where all the agencies had got together, worked really collaboratively and collectively, we could really see the impact in terms of the change in practice, and most importantly, the impact on adults who are at risk of self-neglect lives. I mean, some of the quotes from the individuals I put in the report are such things like, "I wouldn't be here if it wasn't for the staff that have wrapped around me. The difference they've made to myself and my family has been totally significant." There's a whole series of quotes that you'll see in the next annual report about the impact. But that's how I undertake scrutiny, where we really triangulate, get the practitioner's view, really understand what it's like working on the front line, really understand what it's like to be a service user, and to hear their voice and the impact of that work on them, because that's critical in helping us both celebrate some of the excellent work and identify areas where we might need to improve.
Thank you. Just thinking about the all age exploitation subgroup, I just wondered if you have any information about how that's progressing.
So it is a big group, and we've now had 3 meetings. So we're still in that stage of sort of establishing our core business, although we do have a work plan that extends the areas of child exploitation, adult exploitation, and transitional safeguarding. So that period of where a child who may be receiving a service for a safeguarding purpose then moves into adulthood, just to look at how we can strengthen and have a robust system so that those young people don't fall through the gap in terms of criteria for children is very different to criteria for adult safeguarding. And so it is an all-encompassing and a very ambitious plan, and that will take quite some time to move through those stages. I think that there is a commitment there in terms of we need to get this right, but of course experience will tell us it's better to do it at a slower pace, engaging, ensuring there is co-production and consultation to ensure the success of any change, practice change, any protocol introduced, any strategy introduced. And I think what we've learned through the self-neglect experience is this is, for us now, a tried and tested methodology, rather than start with designing what you think would be the ideal strategy locally, to then when you start to try to implement that, understand that actually there aren't the resources, or indeed the developmental stage of where we're at is ready to embark on a new way of working. And I think by taking it at a slower pace, there is more likelihood of being successful. And of course, what we've learned through the self-neglect is that the agencies need to be prepared for that increase in terms of service demand. And because exploitation is a far-reaching safeguarding area, we need to be as assured as we can that agencies that will be dealing with individuals that find themselves at risk of or indeed exposed to exploitation, that the services that are readily available in order to wrap around those individuals so that they feel satisfied that they are able to access a service when they need it.
So would you say that the services have been able to meet those increased demands when you've ran particular campaigns or issued reports and it's perhaps seen a surge? Are you receiving that feedback that they're able to meet that demand?
There is certainly we've had feedback at board around the particular pressures that that has put on adult safeguarding services. In terms of then you've seen some of the figures in the annual report for last year, the very significant increase that has come in referrals. My report highlights that there is a lack of step down, what we would call step down capacity within the island. So when statutory involvement with services might end, there are not necessarily the services that might be there to support those individuals to maintain the improvements. And the same, of course, we would, as my report highlights, we don't have a significant and joined up early help offer on the island, which again is the route that normally after statutory intervention with statutory services such as Manx Care Children's Services or Adult Services, then the person would step down into more community-based services, and there are gaps in terms of the offers there that I know that then agencies are working to try and look, well, how can those be developed? But that is and certainly in talking to the practitioners, that many of those practitioners are going above and beyond their roles in a sense, in that they're keeping in contact with people, checking in with them because they're anxious about if they close the case or they end their involvement, that then things will deteriorate for that individual again. So, and it feels like people are doing a lot of that within their own time, which has an impact then on the resilience and the capacity and the emotional well-being of staff, which is something I've raised through that scrutiny, because I am concerned that about how we're going to maintain and keep up that level of intervention and contact with some of those individuals.
That's suggesting to me, and you put me straight, but whether cases are being closed too early in order to manage the increasing workload that's coming behind it. Do you think that's what's happening in practice?
There's certainly, in terms of the adult statistics, no evidence that that's the case, because actually re-referral rates are low. I think the concern is that perhaps cases are kept open for much longer than they should be, and in terms of the threshold for that intervention people are holding those cases because they're anxious about what will happen, certainly in the adult world. In the children's world, we are going to be doing some work collaboratively with Children's Services and the Safeguarding Board around re-referrals, in terms of definition of re-referrals, and again, because there is not that joined up early help offer, and family support offer, families are reporting to me that they don't feel that there are those pathways in to support them. And again, if they step down, then what's the support to try and maintain some of the changes or improvements that have occurred in their family if there isn't that support available at a local level. So it's definitely something that I'm very concerned about.
Could you just explain to us what that early help model would look like?
In other areas, so in other jurisdictions, there've been particular government initiatives around improving early help, joined up early help provision, and that would include such things as family support hubs with a range of multi-agency and community-based services that would link into those hubs. So at the very earliest point, being able to identify what does that family need, what is the best person or route to get that. So is it the school that might lead on a piece of work with other providers around? So there's a menu in most areas of services, multi-agency services that then would wrap around that child and family at the earliest point possible. And of course, because that doesn't exist locally, now there is in the island plan, there is an early intervention framework that Public Health are leading on, and there is some work that is commenced in terms of family support and parenting, but it hasn't led as yet to any concrete services or offers. And the board, actually, interestingly, this week we're having a discussion about that, and I've asked for some update on that work, because I think it is a key area in terms of safeguarding, because we'll have more safeguarding referrals, abuse and harm occurring if there aren't some of those early intervention support opportunities for families, and they're consistently saying that locally, that they don't know where to go to get help often. And they can identify, as you saw in the exploitation report, they can identify particular issues in their family, particular issues, as I said, around some issues around neurodiversity with maybe one of their children who clearly has much more complex needs than perhaps some of their other children in the family, but they feel that the pathways are not clear about where they can go to seek help. But we can see that some of that's improving, as my report said, in terms of the new money that's come into the CAM service, that I Thrive model, but there's still a need to have a really joined up approach between services, and in my opinion, a clear offer that is available for families at the earliest point.
Thank you. Just want to change topic slightly here. So when we met in 2024, we asked about work in relation to financial exploitation of the elderly, and you were exploring the possibility of doing some awareness raising other than in Safeguarding Week. And could you tell us what progress has been made in that area?
Yeah.
So we've had social media campaigns around financial abuse that has been sent out through our social platforms. We've had various discussions with our adult safeguarding group around financial abuse and other forms of abuse, and that isn't just a one-off. We've repeatedly promote awareness raising throughout the year, so it doesn't just fall into Safeguarding Week. As I said earlier, campaigns some are on a repeat cycle, just to keep that topical for people, and through the adults group there will be some further work that's undertaken in terms of having something concrete on our website in terms of identification and where to go and what to do about that.
Can I just explore that a little bit more? So sounds like quite a lot of it is digital or awareness through a website or social media. Are you pushing some of those messages out through more traditional forms of media, such as newspapers? Because I'm just conscious that older people who might need to understand these issues and perhaps then recognise that this is happening to themselves, whether we're pushing the message out in a wider variety of methods.
We have talked about that, and I guess it's fair to say that haven't progressed that beyond discussion. But I think that's a very good point, that, not everybody is electronically literate, or in fact choose to use those social media forms. But we are getting the messages out through posters and things, but not in terms of newspapers.
Thank you. You just mentioned in your evidence last year that the adult safeguarding team has received 11 referrals concerning adult exploitation, and some of which were financial. It's a bit difficult to tally this with the information in your 23-24 annual report, as there's a category for financial abuse and one for exploitation. Are you able to tell us what levels of reported financial exploitation of the elderly are?
So in the latest reports that we had to board, and this is very difficult because the categories can never fully explain or help people to understand, because, for example, in domestic abuse referrals, clearly a huge aspect of that can be around, certainly in cases of coercive control, about financial abuse. So some of those that are actually more about financial abuse may be coded as domestic abuse. But in terms of the financial aspect, there were 69 cases that were reported to board in the latest data set overall. But and again, as I said, that they cross over. So in terms of, although physical abuse would clearly be the highest category, again, we'll also see that there's aspects of maybe both physical and financial abuse. So the figures can never truly give us the sort of full picture of the prevalence, if you like, because again, psychological abuse, which is quite a high figure at 119. Again, some of that psychological abuse will also be often around financial, and it's a tricky area because obviously 60 to 80% of this form of abuse happens within the home, and unfortunately it's in terms of through relatives, family, or those that are very close contacts who have built up a trusting relationship with that individual. So it's more about, as we were talking about this week at board, it's trying to understand what action has been taken, that robust assessments have happened in respect of that, and the outcomes then for individuals as a result of the intervention, rather than always being able to classify the actual extent. But and the adult safeguarding team are doing more work in terms of their categories to try and help them understand and explore some of those complexities around, as I said, domestic abuse, physical abuse, psychological abuse, and financial abuse. So they were talking to us about that. So they're trying to refine, and they've also done some really good work in terms of direct referrals, because a lot of direct referrals would come from the police. And they've now got a new system that they have agreed, referral mechanism, that all contacts with the police in terms of vulnerable adults now go through to their wellbeing, their wellbeing partnerships, and so there's that clarity in terms of making sure that someone knows that there's been that referral, even if it doesn't meet the threshold for adult safeguarding at that point. So they've been really trying to improve and tighten up their systems. We've seen a lot of that, but they were saying to us this week that there's still more work to do in that adult safeguarding arena within the adult safeguarding team in Manx Care.
That's useful, thank you.
But it was encouraging. It was encouraging to hear, I have to say, as the independent chair.
Could I just follow on for that? And you were talking about psychological abuse there, and there are quite high numbers really on that reporting. And you've got a subgroup that is around training. Is there any training around coercion and coercive control Is that a particular topic for
It's
training?
part of our domestic abuse training. It's a critical part of the domestic abuse training, and we've been really rolling out a whole series of training sessions in relation to that. And of course, it's a key component in terms of the adult safeguarding training as well.
Okay.
And within the adult social work service itself, they have facilitated their own level 3 safeguarding training internally. So it's not just what we coordinate from a multi-agency point of view, there also is training that's going on with internally for individual agencies.
And how are people trained, professionals trained? Because you said referrals are coming in via police, direct referrals. So how are professionals being trained to recognise coercion and abuse when it's sort of disguised as care, or it's within family members? How are they being trained to recognise what it is? It's very subtle, very under the radar, but extremely important.
Absolutely, and that's one of the topics that comes up in that day's training, both at level 2 and at level 3. So different levels for different roles and with the role responsibilities in terms of practice operationally. So that is in terms of training. Although it is training, there's lots of the sessions are very interactive, lots of discussion based, case studies set. So talking about scenarios, so that subtlety in terms of coercion, control, and that features not only in the adult safeguarding training, but also in the domestic abuse training too. And I think that coercion and control features in a lot of our training courses, not just specifically for adults, but also in the children's world too, because of course children have parents and parents are vulnerable adults at times. So it is a running feature. And also it features within our professional curiosity workshops. So it's really kind of getting practitioners to reflect on their own practice rather than somebody stand at the front with a set of PowerPoint slides and talk at them and talk at them and talk at them, because, you know, there's only so much you can absorb. But I think with that way of learning from each other and through real life experiences, they're able to share some of those light bulb moments that then lead to other practitioners reflecting on, oh yes, I've had a similar scenario, and through that joint discussion is where those the subtlety, how important it is to be able to look wider at scenarios rather than look at it in a more sort of focused linear way, to, as you say, to pick up on those subtleties.
Thank you. So we've already spoken quite a lot about multi-agency working. So when the last time we did speak, you mentioned that the multi-agency safeguarding hub pilot was due to conclude. Has this initiative continued, or did you?
Yes, it has, and from what we've had reported to board, that some funding certainly for some of the agencies, I think, has been confirmed in terms of then the continuation of some of those staff. And I know that the agencies around the table have been committed to, because they see the positives of the sharing information at that earliest point, working together collectively. So I understand that the finance has been agreed. There's a report due to go because the multi-agency safeguarding hub, the governance of that falls within the community safety partnership. So I understand there's an update due to go to the community safety partnership on the end of the pilot, and the next stage is, I think it's later this month or next month.
At the end of the month.
At the end of this month. So So that's what we understand the position, and we've agreed as a board that we want, because obviously it crosses over with the assurance in terms of that's working in the way that it needs to, and so we have planned some further assurance as a safeguarding board about how that's working into our assurance programme. So we have a detailed assurance programme of what we need to have assurance on moving forward over the year. So we have a plan, and it's part of that. We've agreed that we'll have regular updates from the MASH about how that's working.
Okay, so from a board perspective, it's having a positive impact on safeguarding.
Certainly in terms of the sharing of information and having the right people around the table to have those conversations. The speed, what we're hearing is at the speed of response, because you've no longer got to track agencies down and find them. If you need to have a strategy meeting where there might be a concern that there's abuse or harm, they've got usually the people, some of the people around the already there and able to step forward. So the speed of response, we've been told, is quicker, and they've got that live sharing of information across systems. So they can lean over to a colleague and say, in this safeguarding scenario, what do you know in terms of the history of concerns, or so you're getting a much more holistic picture of the circumstances at a much earlier point.
Okay. And actually, talking about information sharing, it was something we talked about last time, and you highlighted as a challenge, and actually other departments and agencies that we have had evidence sessions with have also highlighted that as a challenge. Has any progress been made with that since we last spoke?
So very much as we're aware, we talked about last time all the work we'd done in protocols and podcasts and training, but we were still seeing those significant barriers in a fear from staff in reviews, etc. we've done about sharing information, which is why we've got, as I mentioned at the beginning, the amendment bill. So the Safeguarding Act amendment bill will be focused on a duty to share information for safeguarding purposes or promoting the welfare of children, young people or vulnerable adults, because we feel actually having it within legislation is the strongest way to really dispel any of those barriers or misunderstandings, and this is similar to certainly in England, despite the Starr Hobson and the Arthur Labino Hughes case, which caused massive concern around why practitioners still weren't sharing information in those circumstances, and there was a lot of discussion about whether there needed to be changes to legislation, etc. The government now are also putting that into legislation in terms of the Wellbeing in Schools bill in that context, but we are making a small amendment to the Safeguarding Act, which we feel, if that hopefully will pass through and be agreed, but we are really hopeful that will, and then we'll do a lot of promotion about what those duties mean to staff, further training, and we've been doing some other work on consent, about understanding consent, and again, when you've got a safeguarding concern, you don't require consent of individuals to take further action or move forward to undertake further assessment or investigation. So we hope that will, but after a lot of discussion, we felt that was the approach that we needed to take as a board to really ensure that staff are clear, professionals are clear about their responsibilities.
Can I just build on the issue of consent then? What sort of parameters are around the definition of consent? You know, when can the team decide that they don't need the consent of the individual, and it's necessary for there to be some sort of intervention?
Well, if there's a safeguarding concern, consent is not required to progress that. But of course, this is an art, not a science, in terms of, so it is about where people could then get themselves confused about the level of concern and is a sufficient level of concern. So we have a piece of work that came both, it's linked to some of the findings within the Ofsted report, some of the findings within our serious case management reviews, and some of the issues that we've been finding during scrutiny as well. So we have a particular piece of work going on with practitioners on the front line around consent, with the view of having some new protocols, some additional training and input to ensure that staff are professionals rather are really clear around, again, when they can dispense with consent. But it can be a complex area and can be a barrier. But we're doing a piece of work. I don't know if there's anything else you want to add about that piece of work. No,
I think that's progressing very well. Our indicative timeline is being delivered to, and we will have finished the co-production of that piece of work, and embedding starts at the beginning of July, and then we plan an evaluation and impact analysis in December to see how the product has landed, what the impact that's had on practice, and also are there any further considerations that need to be made following the impact analysis, because of course it's only as good as the last iteration, and sometimes it's not one size fits all. There may be some barriers or some areas of complexity that we haven't thought about in terms of pulling that piece of work together, because I think the difficulty is that people and social problems are complex, and one approach may not work, and we need to be sort of flexible in terms of varying that in order to meet the level of need that's required in the most effective way possible.
Thank you.
Okay. You mentioned within the Island Pan, the Safeguarding Amendment Bill is within it. It's been obviously within Cabinet Office, and you've already mentioned that information sharing frameworks or whatever will be included in that new legislation or amended legislation. Have you any idea when that will be coming through, or how much work
it begins to move through the branches in the middle of June?
Okay.
And we hope to have it completed and receive royal assent by December.
Okay, thank you. Okay, so and you mentioned when we've spoken previously that you were working with Children's Service Improvement Board and taking a lead role in addressing some of the recommendations of the Children's and Families Ofsted report. Can you tell us how that's progressing?
So the Children's Services Improvement Board was stood down last September. Right. And where the Safeguarding Board were involved was really in the taking forward that work, because there were particular issues raised about exploitation. But as we've already talked about, understand that work around exploitation has got to be multi-agency. It can't be single agency work that's going on within one agency, which is the work we've talked about earlier. So that's where the Safeguarding Board and that the subgroup we've talked about has been delivering then on the improvements in relation to exploitation, making sure that's a joined up approach.
Okay, so are those recommendations that Safeguarding were leading on, have those all been completed now?
So they've been absorbed within the, as I've termed it, the practice and process phase. So those Ofsted areas are definitely with it, because it is a comprehensive process that is needed that covers some of the criticism that Ofsted picked up in terms of purpose and function of meetings, ensuring that missing children are considered within the exploitation sphere, rather than splitting off various concerns, that you're seeing the child as the whole in terms of the concerns that may be indicative of risk of exploitation.
Thank you. Mr. Glover.
In October 2024, Tynwald approved regulatory changes to amend the disqualification period for independent board members who had previously worked in statutory services, and it was from 10 years to 2. So has that assisted you to fill board vacancies as you were hoping and mentioned the last time we met?
It has indeed. We are happy to say that we have managed to recruit 3 new board members who actually were having the induction with this afternoon, and will attend their first board following that induction. So, and we got a good range of candidates having been able to make that change. Really, and we've got some very strong people with a good background and experience in safeguarding and working in sectors on the Isle of Man that are going to be joining the board. So we're very happy about that.
Good news.
Could I just ask one question on that? I assume there is risk of conflicts in that. Is that easily managed? You know, with that coming down to 2 years. Is it 2 years? Yes.
2 years from 10, yeah.
You know, so people recently working in those services may cause conflict in certain cases. Is that easily managed within the board?
Usually, and actually, interestingly, with the particular candidates that we have, without going into the detail, that's not such a significant issue because some of them have been out longer than that. And obviously that will be part of the discussion with them and part of the mentoring of those workers, and obviously at meetings, etc., we do ask for any declarations of interest. So if there had been a particular issue that we're talking about and as a topic, one of those individuals had been involved in a piece of work, they're required to declare that, and we'll be talking to them about they actually need to really declare it in advance, and then we talk about how best to manage that during the meeting. So in some partnerships have worked, and actually we actually say to the individual, it may be easier if you're not part of that discussion or in the room for that discussion. But I shouldn't see that with the particular candidates we got it should be a significant issue, but it is that everyone actually needs to be aware of as a safeguarding, even chief executives and members of groups may do have other activities outside of and be involved in local activities or things that that may then come within the remit of the safeguarding board, so would be required to, and then we talk about how we're going to manage that within. So feel fairly confident that we'll be able to address that.
So the biggest change there is not necessarily the 2 years, but the actual coming down from 10.
Yes, yes. I mean, it was it's quite broad as a field of candidates that was really considering that we'd been out 2 or 3 times before trying to. So it's the right thing. We need people that have got some up-to-date safeguarding knowledge and recent safeguarding knowledge. I'm not quite sure why that period was previously in the, but it did impact on trying to recruit good people into the role.
Your website says that board membership is under review. Can you tell us more about that, please? What the review is looking at? Okay, so
it's a part of the amendment bill. It is actually around taking the membership out of the primary legislation and putting it into regulation, because post titles change. When the Safeguarding Act came into being in 2018, we didn't have Manx Care, for example, as a key, but they are a key provider of safeguarding services, and it is absolutely critical that the representatives from those organisations sit as part of the safeguarding board arrangements. So that is why it says those are under review, because we're looking to take those out, but we're not looking to make any. What I've done is I have co-opted relevant members, because there is a clause that allows me to have whoever we think is necessary on the board. So thankfully that clause did allow me to ensure that Manx Care are part of the safeguarding board arrangements. But of course they technically wouldn't have the same sort of rights or voting rights, as I understand it, as other members. Not that those are required necessarily, but you never know. So what we will do, and some of the stuff in the legislation around health representation, because again changing roles and functions, we want to look at who are the people that we really need around that board to do the business. And again, that may change over time as the board and the partnership begin to develop. But at this stage, we are still maintaining the view that it is the senior leads, executives, chief constable, etc., that should be a member of the safeguarding board at this point in time.
Mrs. Knish.
Thank you. Just turning now to your annual report, the 23-24 report. We touched on specific referrals regarding financial abuse of the elderly earlier, but your report noted overall that referrals to adult safeguarding increased from 862 in the 22-23 report to 1,169 in 23-24. Can you just tell us a bit more about this?
So the presentation, as I said, we had on that this week, it does demonstrate that actually in terms of the latest referrals that those referrals are levelling out. But of course the demography does mean that demand is likely to continue to rise, because we see that abuse and neglect, and that the figures evidence this, abuse and neglect is more prevalent in the older age group because of many of the sort of complexities with issues such as dementia, diminishing capacity, different things around that. And of course we know that from the demographics that age group locally is going to increase by I think 40% by 2030. Don't quote me on that statistic, but we know it's going to increase. So again, so there's been with the new assistant director that has within adults within Manx Care has done quite a bit of work in terms of scoping against other jurisdictions and looking at rates and looking at whether those referral rates fall in line with what you'd expect in terms of adult safeguarding, and now a view that actually the referrals are much more in line with what you would expect in the area. But as I said, it does show a sustained increase, which puts significant pressure on colleagues in adult safeguarding and within Manx Care in terms of response. And they've only had one full-time equivalent. We heard increase in staff member. So certainly that's something that's very much that the board will be continued to look at in terms of the pressures within services, wanting to be assured that isn't having an impact in terms of then practice that we see. And as I've already talked about, some of those pressures of staff having to hold on to cases because or having to continue their involvement because there aren't other services to step down to is a pressure area we recognise.
So you've just mentioned there that there's been an increase of one full-time member of staff.
As we understand it,
yeah.
yes.
Do you have an idea of what the numbers actually are in the safeguarding team currently?
Don't think I have that to hand. Would you?
I couldn't say with certainty, but I think 4 social workers and a manager.
Thank
But
you.
I'm not absolutely
we would
certain
need to- we
about
would
that.
need
It'll
to
be
check that
something
for
that
you.
would need further clarification from adult social work.
Thank you. And just, you mentioned there about sort of this comparative analysis with the other jurisdictions. Were there any specific jurisdictions that were looked at that you're aware of?
I think, well, I looked at the All England data in terms of what would you expect the referral levels to be, looking at the All England data as a, and as I say, that was done by the Assistant Director within Manx Care, so I wouldn't have all the detail of exactly how he scoped that, but it was helpful too, because we do need to make sure we're able to benchmark, and that's what he has been very focused on, coming in about what we'd expect to see, and doing much more analysis around the data. So we're really getting into, and the board as well, really good analysis about, well, what is that actually telling us? Is that the data that we need to have sight of? What other data do we need to collect to both be assured and well informed about patterns both across adults and children?
Thank you. Also in the reports, a number of allegations against people working with children or vulnerable adults, and there were 16 substantiated allegations in total. Is this a concern as to the numbers?
Well, it's good. It's good in the sense that we now feel that obviously, because we talked to you last time about the new MASM policy, so it's where that didn't exist previously for adults. So we can now see that there an increase in those adult cases, so that we'll get some better analysis of now that we've implemented that policy now at the end of year through the data and the work that we'll do around the new data set, in terms of, is this telling us anything in terms of patterns, in terms of robustness of recruitment processes, or any issues around if it's through volunteers, how are some of these coming to light? So it's good that we're now recognising those, because we're always going to have those, unfortunately, those circumstances where people are in a position of trust. But what you need to have is well, what are the systems working well to identify that at its earliest point? People able to recognise where they may have a concern, are they reporting that concern? So definitely we'll want to do some analysis on the end of year data from March about what's telling us about patterns. But Christine, you might have some more.
In terms of measuring the success of the new policy, what adults safeguarding tell me is that in 2023 there were 14 referrals into the MASM process. This year, total to date is 40. So whilst you might expect a spike because of the promotion of it and awareness raising, I think that will level off whenever there's further promotion of it. People are thinking more, they make the referrals in, not necessarily those referrals meeting the criteria for a MASM. It might be that it's more consultation to unpack some of the concerns that the referrer may have. But I think in terms of, the message getting through, I think that their raw data is showing that definitely is happening.
So I think it's quite common knowledge that a number of roles have a requirement to undertake sort of DBS processes. Is it on your radar that those processes maybe should be broadened out in some areas where there are risks of people working with children, and they may be perceived as trusted adults but are not obligated in any way to undergo that process?
I mean, we've made it very clear as a board that that where someone is working with a child, young person, on a one-to-one basis, that those do need to be in place. And our organisational standards audit that we undertake then, that goes out to each agency and asks them for what they've got in place around that. Is it robust? and so we're due to do that again shortly. And interestingly, as part of the adult scrutiny, we have agreed that we're going to extend that to housing commissioners and others. So making sure that the reach of that is even greater, because it's asking them those searching questions about your safeguarding policies, your have you got checks in place for all relevant staff? So yes, we'll be asking those sorts of questions of providers. But there's probably still work to do, to be honest, in terms of the charity and voluntary sector in absolutely ensuring that they have the necessary mechanisms in place for checks, balances, references, all of those things, and those are sufficiently robust, which is why it's quite important that we look at that new data that's coming in, and look at whether there were any issues identified as part of where investigations did occur that identified any weaknesses in those processes.
Thank you. My final question is, your report mentions the new vision and business priorities. Are these published?
Yes. So on the website you'll find the new business priorities covering 2024 through to 27.
Thank you.
Okay. Just one last one from me, really. It's just to go back to charities and voluntary sector. How does the board engage with the third sector, and how does the third sector feed back to the board? I assume you don't have a member from the third sector on the board.
We do.
You do?
Yes. Okay,
so that feeds in and out directly, hopefully, through that channel.
Although there have been discussions within the adult group, the adult group, about the some of the reach, both to sort of social care providers on island, and of course there is no one mechanism that is a route into the sector, which does create some challenges in terms of spreading the message. But it is an area that's on our radar in terms of trying to, but it's difficult because there's no one umbrella group that can give us easy access in terms of spreading some of those. But there has been some work done in the adult group about that.
Yeah, and we also have an increasing number of delegates that come to our learning and training events from the third sector, and I think that our reputation and knowledge of us is growing in the third sector.
Do you have many referrals from the third sector? Do you collect that kind of data, where it's coming from?
Yes. Well, adult safeguarding do in terms of their data, which I just turning to. So they have a list of the whole series of whether it's from a voluntary organisation, residential private providers, voluntary. So yeah, they have a long list of where referrals come from within their piece. So it's quite a long list.
Do you use that data to prioritise where you need to sort of put awareness and training in most?
Not specifically in terms of, because it's hard to with sort of such a long list, but they have been looking at then that their awareness raising sessions and training, and it's something that within our adult group we've been very keen to get a wider representative. So we've just had the fire service, the ambulance service, private provider, GP now representation on that group, again to try to get to some of those harder to reach. And as Christine said, then that voluntary sector representative in terms of. So there's definitely still work to do, both both by the board and across government, about raising the profile of safeguarding still, despite all that we've done to date and want to continue to do. That there's still work to do.
Can I just follow up on that? I promise my last question is the final one, but just listening to the flow of questions and reflecting on what's been happening in the UK in relation to safeguarding issues that have happened in the church, which is fairly recent news. Is there much engagement here with the different churches and the work that they try and undertake with safeguarding and ensuring that their processes are robust?
Not specifically targeted at the faith sector. Our offer is open to all sectors, but in terms of specific work with the faith sector, no.
Thank you.
We did have some presentation from the faith sector last year at the safeguarding.
So we did have some sessions particularly put on in that sector, not on the exploitation, but specifically on the first session we did. But certainly, again, an area that we can focus on strengthening.
Thank you.
So before we draw the public session to a close, is there anything else that you'd like to share with us?
I don't think so, unless you've got any supplementary questions for us. No? Well, all that remains is for us to thank you very much for your attendance today, and we will now sit in private.